Good morning. All right. Thanks for being here this morning. My name is Holly Brenner. I'm the Vice President of Strategic Development and Marketing for our system. Glad to see so many familiar faces and a few new ones this morning. We'll get started right away with a reflection. This one is called Optimist versus Pessimist. A family had twin boys whose only resemblance to each other was their looks. If one felt it was too hot, the other thought it was too cold. If one said the TV was too loud, the other claimed the volume needed to be turned up. Opposite in every way. One was an eternal optimist and the other a doom and gloom pessimist. Just to see what would happen, on Christmas Day, their father loaded the pessimist room with every imaginable toy and game. The optimist room he loaded with horse manure. That night, the father passed by the pessimist room and found him sitting amid his new gifts, crying bitterly. "Why are you crying?" the father asked. "Because my friends will be jealous. I'll have to read all these instructions before I can do anything with this stuff. I'll constantly need batteries, and my toys will eventually get broken," answered the pessimist twin. Passing the optimist twin's room, the father found him dancing for joy in a pile of manure. What are you so happy about?" he asked, to which the optimist twin replied, "There's got to be a pony in here somewhere." I thought that was kind of fun. So today we have with us Janelle and a couple of her helpers to talk about, what exactly are you? Remodel your lifestyle, okay. Their costumes are really throwing me off, I'm sorry. And of course we have Dr. Sheridan here. He's going to share the new Genesis Laser and to talk to us about what that is. And Dr. Stephenson is here and she'll be talking more about ankle replacement surgery. So we look forward to hearing from both of them, but we'll get started with Janelle and this skit, I'll call it.
Hi, I'm Janelle Baldwin from The Zone, and I'm going to be talking to you a little bit about RYL, Remodel Your Life. Who's heard of Remodel Your Life before? So it's getting bigger and bigger each year. Remodel Your Life is a program that all associates are eligible to apply for. It is a 6-month program, and it starts May 1st and runs to October 31st. You're going to have support in this program. So if you want to remodel and change your life, most people want to do it, but they need that help. So we're going to offer you a 6-month Zone membership so that you can work out. We're going to offer you dietary support so they can help you with meal plans, changing what you're eating, working with different health issues that you have so that you get a food plan that's good for you. EAP support, the Employee Assistance Program, because we all have barriers to accomplishing our goals. So don't think of it as a negative thing, but think of it as someone that you can talk to about, they're distracting, about maybe changing how you manage your time so that you can fit workouts in, so that you can fit cutting up healthy food. Who has been a member of the Clean Plate Club before, or still is, that you must finish everything on your plate? So that's a barrier for people. When you're full, you should stop eating. So EAP can help you with a host of those things. And then you'll also be assigned a mentor, and that's someone that has either been through the program or has a healthy lifestyle themselves, that they can really relate to you, the struggles that you have, celebrate the triumphs with you, and just help you work through some of those issues. We'll also help you take your goals and make them SMART goals. SMART goals are specific. SMART goals are measurable, they're attainable, they're realistic, and they're time-based. So goals such as maybe reducing your waist circumference, that might be a goal that you have. Or what about your numbers? Are you familiar with what your numbers are from your health risk assessment? So you might need to work on your blood pressure, you might need to lower your cholesterol, you might need help with that BMI, just all the things that are on that scorecard. We can help you change those numbers to better numbers and fill in the blanks for you with that. What about more energy? Does anybody want more energy? We can help you get that. We can help you have a better quality of life, just whatever goals you have. And what about Miss Jonna here with her smoking issue? Smoking cessation is something that, as a company, we're really trying to work on. And we're going to help you with that because some people are afraid to stop smoking. They feel like they're going to gain weight or switch addictions. We can help you with that with our well-balanced program. So applications are available online now. If you go to Associate Resources on the intranet and The Zone and scroll down, you'll see RYL or Remodel Your Life applications. Just download that, fill it out, and return it to me at the zone before March 7th. We'll be doing interviews after that, and this year we're able to take 6 participants. So thank you. If you have any other questions, feel free to email me. I'm in the global list, Janelle Baldwin, or give me a call at the zone 926-5300. Thank you.
Okay, first of all, we're going to start out with a little overview video of the laser treatment for you.
Our feet, they take us places. They allow us to exercise and play, and yet for many, they can be a source of embarrassment. We avoid talking about it, we hide it as best we can. But over 25 million Americans suffer from toenail fungus. Called onychomycosis, this infection can cause nails to turn yellow, thicken, and over time, they can become brittle. Fungal infections can be caught in common places like the gym, swimming pools, and nail salons. They may cause pain and are often embarrassing.
I first noticed I had toenail fungus about 10 years ago, and it was very embarrassing to me. I was self-conscious about it. I didn't wear certain shoes. I always had to have a perfect pedicure. I would never just go out with a pair of flip-flops on unless my toes were completely covered with nail polish, and it made me self-conscious all summer long.
My toenails were quite unsightly. My wife called them inhuman. They were really in bad shape.
By the time most people turn to their doctor, they have already tried over-the-counter topical treatments or oral medications with little success.
And I've tried various creams, and then as an adult I tried oral medication, and I didn't like the side effects because it had something to do with your liver, and I had to go for monthly blood work.
About 10 years ago, I did 3 rounds of the oral treatment. And I was nervous about that because you did have to have a blood test and worry about an adverse effect on your liver. But I was desperate to try to correct the problem, so I went through it 3 times. It was quite expensive, and I had no success with it.
Many people turn to their doctor convinced they will have to live with ugly nails for the rest of their lives. If you have toenail fungus or are embarrassed by your nails, there is a new solution: Genesis Plus Laser Therapy. Genesis Plus is a fast treatment that takes your doctor approximately 20 minutes to perform. The treatment is very tolerable, requires no anesthesia or numbing medicine, and there is no downtime following the procedure. Genesis Plus is a very safe and effective procedure that does not require a lifestyle change or regular blood tests to monitor liver function. Unlike systemic oral medications, laser therapy is targeted directly at the infection. Unlike topical treatments, laser therapy is able to penetrate the nail plate to get to the fungus. The Genesis Plus laser safely penetrates the nail, delivering heat to the nail plate where fungal colonies grow. After 3 to 6 months, healthy new nail growth can be seen. Some people may require more than 1 laser treatment. The number of treatment sessions depends on the patient and the severity of the fungal infection. Your doctor will advise you on how many treatments your nails need. Following the treatment, you can immediately resume your normal activities. Preventive maintenance may be recommended, so be sure to follow any post-procedure guidelines your doctor recommends to minimize your chance of reinfection.
With this particular treatment, I made the appointment, I came in, 15 minutes later I was finished, and I can go back to my regular activity. I don't have to have any special shoes on or do anything different. I just go back to putting my shoes on. It's easier than a pedicure.
The Genesis Plus laser has been cleared by the FDA to be both a safe and effective procedure for the temporary increase in clear nails in patients with onychomycosis or nail fungus. The laser can also be used to treat warts and reduce scars. Ask your physician about the Genesis Plus laser treatment for toenail fungus.
Anybody who asks me about this problem, trust me, not too many people talk about it, but if they do ask me, I'll recommend Genesis Plus Laser. It's been very simple.
What we'll do now is we'll just go over the laser itself a little bit and how it works, and then we'll go through some examples of before and after slides on it. But basically, laser safety, it's a very safe unit. The main thing is that we have to watch out for any eye involvement. We don't want the scattering of the laser to enter the eye, so we have to do it in a closed room with no windows on it. We try and take away any type of reflective material thing that's going to be shiny, and everybody's got to wear goggles. So you can't wear just a regular pair of glasses. You have to have special safety goggles so that we don't have the laser beam scatter. And everybody in the room has to wear one, the doctor as well as the patient, anybody else that's in there. And we have all that available in the office there. But basically, there's nothing really significant that can occur otherwise. Basically, the way the laser works is it's a heating unit. And it heats up the tissue of the nail and obviously the tissue underneath the nail where the laser, where the fungus particles survive and thrive. And it kills the fungus tissue and doesn't damage the normal tissue around the nail and the toe. There's a heating parameters that we have to have, and the laser can be set at the proper parameters for killing of this fungus and not damaging the normal tissue. Initially, the lasers didn't have much penetration, and the first generation of lasers didn't have the depth that we really wanted to get consistent killing of the fungus and have proper results. But the new laser that we have here, this 1064 YAG laser, as you can see, has the best penetration available. It's the top of the line unit for this treatment, and so our results are going to be very, very high with this. Also, with this laser we have better spot size. Originally, the early lasers did not have the depth of penetration that we like to see, and so we have a larger spot size with this laser, and so we have a lot more consistent heating of the area, and again, better killing of the fungus tissues for better results. And this laser is, again, a 1064 laser. And we just have to be a little careful with certain types of things, but it can be safely used in all body parts, really. But we got to watch out for tattoo areas and deep colored areas, so we have to watch out for self-tanners. And there's a fair amount of that around. People are tattooing their feet quite often, and we have to kind of watch out for a little of that. But basically, we're using it for warts, nails, obviously, and even scar reduction. You can use it for other things, but we don't see too many wrinkles on the feet that people want to have treated, so we kind of stay away from that. But this is what we'll see. You'll see a nail that's yellow and discolored on the left-hand side here, and then after treatment, this is what we're looking for. 9 months after the final treatment, we're looking for a clear nail as the result. We don't have to do any nerve blocks with this. We do have to be a little careful with patients that have diabetes and peripheral neuropathy because they can't have the normal feedback from when it heats up to let us know if it's getting a little bit too warm. We have to make sure everybody's got their nail polish off, and again, we don't want to do anything with tattoos. We got to keep away from the tattoo areas. And again, about self-tanners, we have to kind of stay a couple weeks away from someone that's doing tanning booths and things like that. Basically what we do is we grind the nail down to thin it out as much as possible before we treat it. And sometimes we'll take pictures before and after if people wish to do that. But we have to treat around the entire nail. We don't just treat the nail here, we kind of treat around the rim of the nail to make sure we're getting all the tissue and the fungus particles that can be around the outside areas. And we have that 5 millimeter spot size, so it's a good, fairly good size spot size, so we can get this done in a more efficient manner. When you have a smaller spot size, it takes a lot longer to do it. So, and the laser works in pulses, and so there's about 2 pulses per second. And with the big toe, we have to do 600 pulses, and with the lesser toes, we do 100 pulses. And that's how we know that we've had enough penetration there. And what it basically, if you look here, the laser is the pink circle, and that's the effective treatment area, and the red dot in the center is the aiming beam. And so when we have the red dot in the center of the pink circle, then we know that we're at the right distance from the nail to provide the penetration to kill the fungus particles. And then we do it in sequence across the nail. And we want to be about 4 centimeters away from the nail when we do our treatment. But what's nice is the laser calibrates this all and has it all set up for us. So it's pretty easy to do. And basically we make horizontal and vertical passes up and down the nail. And when it heats up a little bit too much, the patient will let us know, and then we'll either back off or we'll just go to the next nail. So we don't have any significant discomfort when we do this. And again, we just alternate between vertical and horizontal passes. And we start out with a slow rate, and then we can speed up if we need to. The end point is the number of pulses. That's what we found that will give us that best result. Basically, we'll treat individual nails. 1 or 2 nails is fine. If you get more than 2 nails, then we treat all of the nails on that foot. And sometimes we'll have to do multiple treatments. We usually do 3 treatments spread out 6 weeks apart, depending again on the severity of the nail. But sometimes you can even do touch-up procedures months later if need be. But here we show the heating of the nail, and we want to be in that yellow range, which is about 39 degrees centigrade to 46 degrees centigrade. That's the optimal killing zone for the fungus, and then it won't damage the normal tissue around the nail. On this side here, if you get a little bit of a hot spot, if you don't keep the laser moving properly, you can get that, but that's just a matter of improving your technique. And again, the more passes you do, the warmer it gets, and so then you can get a little sensitivity there. And we have you can limit that by having good technique. And we'll just go through some slides here of some before and after pictures. This is the typical type of fungus nail we're going to see with the yellowish thickening and some debris underneath the nail. And then we'll do our treatments, and this is about 4 or 5 months later. You can see the clearing of the nail coming through. And this will take another 6 months to grow out, and we'll have a very nice clear nail. Again, this is another example of a global type of involvement of the nail, and you can see the improvement that's starting to occur even at an early stage here. And these are early stages. Now, this is a little different type of fungus that'll occur. It's this linear streaking fungus. Extremely difficult to get rid of, especially with oral medications. But with the laser, we've been seeing very good results with that also. Again, more of a global type of presentation with the entire nail being involved, and then you can see it's starting to change and grow out. Again, this is going to take another 6 months for this to grow out to get the complete clearance of the nail. Again, another linear streaking nail, difficult to treat, but the laser's been really working pretty well with that. This is a more typical type presentation we'll see with a transverse involvement. And again, you can see it's starting to grow out, and this is clearing as after about 3 months of treatment already. And again, there's another one with the linear streaking. This is one that's pretty typical we see with a complete involvement of the nail. And you can see this has been about 5 months of growth here. This is all clean and clear in this area, and this part of the nail will just grow out, and when you trim it across, you'll have a nice clear nail. But again, it takes a full year to see the final results of these. Toenails grow very slowly. Again, another example, again, typical of the transverse presentation. And this is all loose underneath here with all that fungus debris, and that's being killed off, and the new nail is starting to grow out very nicely. And again, another example of a nail that was a little more significantly involved all the way back, and it's starting to clear up very, very well after 5 months after treatment. And there's another one that shows some of these are not severely involved, and they'll respond a little quicker. After 4 months, you can see it's almost totally cleared out here at this point. Again, this one too, it's not that severe of an involvement and clears up very nicely in a fairly shorter period of time. Again, this is a more significant involvement, and again, we can still get very nice clearance with these. Now, after we treat these with the laser, we have the patient put a topical antifungal cream around the edges of the nail to kill any of the fungus particles that want to reattach themselves and reinfect the area. You can see the scaliness around here. There's fungal elements in the skin here, and you can see how it's all cleared up in this slide here. But to maintain that, so these fungus particles don't get back involved, we use the topical antifungal treatment as a maintenance schedule thereafter. Now, after we've used it for the nails, we're also using it on warts. Wart problems on feet are very common. These are the typical type of plantarous warts that get very thick on a thick skin, and we can treat them, and about 1 month after treatment, you can see they're starting to resolve and die away. Basically, we have to crank up the energy intensity with wart treatment. And so we have to be a little more careful with someone has diabetes or peripheral neuropathy, or that has, again, tattoos or darker skin areas. We will do the treatment on the warts, and they basically, with the wart treatment, is the laser goes after the vascular structures of the warts. Warts are very vascular, and it basically cauterizes or cuts off the blood supply to the wart, and then they'll die away. Again, we have to use a little bit higher intensity of heat, and we can select that very nicely with the laser. The thin skin warts on the top of the foot, we use different settings than we would the plantar surface on the bottom. In this particular case, we have to be very careful to stay within the wart border. We don't want to spread it around a little bit like we do with the nails. We want to make sure we're right on top of that wart for the best treatment, and that we don't have problems with getting blisters or anything afterwards. We do have to treat this sometimes more than on one occasion. Sometimes we have to do it on 2 or 3 occasions, spread out about a month apart. And here you can see a little example where individual warts will be treated. This is a larger wart that basically we have to do a couple different pulses in the same areas, apart there a little bit. Sometimes if the wart is very large, we'll have to anesthetize this area. But if they're just single solitary areas like this, we usually don't have to do that. And again, here's another one, multiple warts. We'll do multiple pulses here. This one's a large area. They'll have to have probably 3 or 4 pulses on that area. Possibly this area might have to be anesthetized, but these areas would not. And basically afterwards, it forms like a little crusty, kind of a scabby type area. Sometimes if it gets a little bit too deep, we'll get a little blister, but that's not a significant problem. And then the areas will just kind of slough off over a period of 4 to 6 weeks. And again, here's this area here was treated, and you can see it's starting to resolve. Now at this point, we might wait another couple weeks just to see if there's any couple of spots that might have to be retreated, and that would be the end of the treatment. It's been working pretty well for that. And we can also treat scars. We don't get really a lot of severe scars on the foot that need to be treated. Sometimes post-surgical or post-trauma, people have a scar that would be irritating in a shoe gear, and we can use the laser to thin out the scar tissue, and it works pretty nicely for that. So that's about all we have for this. I'll let Alyssa go, and we'll answer some questions after she's done, okay?
Good morning. How's everybody doing today? Thanks. I'm Dr. Stephenson. I'm one of the newer podiatrists here at Agnesian, and thank you for letting me come and talk today. I'm not going to have any fancy pictures, but we're going to be talking about arthritis and total ankle replacements. So just some basic anatomy, and I do have a foot model over there, and also of the total ankle replacement set. So if anyone is interested, you can look at that afterwards, and also some information, but we can look at the model too. The ankle is actually formed by the union of 3 bones, the talus, the tibia, and the fibula. It has muscular origins above it and tendons below it to move. It contains cartilage, which actually acts as a shock absorber. It actually contains ligaments or straps of tough tissue, which help prevent the joint from dislocating. It also contains synovial fluid, which is a smooth oil-like substance, which makes it easier for the joint to move. The ankle joint acts like a hinge. It's one of the most flexible, free-moving joints in your body. And it can also move from side to side, and it can kind of twist also. When the ankle joint is moving well and functioning normally, it's pain-free. The time that it is pain-free is actually if there's no motion there. But if you have some type of injury or abnormal function, then it's going to have pain. That can come from congenital deformities, acquired deformities, and injury or arthritis. Arthritis is really the wearing away of the joint surfaces, and there's 3 main categories. The first one would be osteoarthritis, and that's the one you hear mostly about, traumatic arthritis or something from an injury, and also inflammatory arthritis. Primary arthritis, or osteoarthritis, can also be called degenerative arthritis. That's the most common kind of arthritis that you'll see. This can be due to activity, it can be due to a family history, or it can be due to wear and tear or things you've done throughout your life, or even age. Traumatic arthritis is arthritis that develops after an injury to the joint. Usually this causes pain, swelling, weakness, and can affect your ability to walk also. It can affect your lifestyle and activity level, and this is usually after an injury, sometimes as minor as a slip and fall or some kind of other trauma like a motor vehicle accident or a fall from a height. Inflammatory arthritis occurs when a disease process causes cartilage in the joint to wear away. Examples of this are rheumatoid arthritis, psoriatic arthritis, and in rheumatoid arthritis, the body's actual immune system is actually attacking the joint lining. Symptoms of arthritis include pain, especially with the first steps in the morning, or if you've been sitting and resting and getting up to ambulate again or walk again, or if you've been driving and then get out of the car to walk. It can also cause swelling. You can get extra bone formation or spurring at the joint. You can get decreased range of motion of the joint, or you can get cracking or crepitus with movement of the joint. Some tests that your physician may do are x-rays to see if there is any bony deposition, an MRI to see what the joint looks like inside, even a CT, blood work if there's an inflammatory process going on, and diagnostic injections to see if the joint is really the problem. And if you get relief from the injection, then we know surgery might be a good option for you. Some non-surgical treatment includes orthotics or inserts for your shoes, ankle braces that start in the shoe and actually go up into the ankle. A type of this would be an AFO, where you have an insert or insole in your shoe and also a brace that goes up the sides of your leg to kind of keep that ankle motion stable. Shoe modifications, like a rocker bottom sole that actually helps your foot move so that there's less stress on the ankle. Medications, and those would include anti-inflammatories such as ibuprofen, steroids, and corticosteroid injections actually in the joint. Surgical treatment includes debridement, allograft arthroplasty, distraction arthroplasty, arthrodesis, and total ankle replacement. And ankle debridement just means you're going in and cleaning up that ankle. If you have bone spurs on each side of the ankle joint, that might limit the range of motion of that ankle. So we can actually go in either through a scope or arthroscopically and shave all that spurring down, or open up the joint itself and clean out those spurs. We also can remove all that inflamed tissue and remove any loose cartilage on each side of the joint and remove the spurs. Allograft arthroplasty. This actually uses a cadaver bone. So if you have a defect in your talus bone or in your tibia bone, we can actually take a cadaver bone and cut a piece the size that is the piece that you are having problems with, and take your piece out and clean up the margins and put the new piece in, and then either fixate it with glue or little screws or anchors. And then you have a new ankle. This is an example of using the glue to do that. This is a patient who had a defect. And what we're looking at here is an MRI, and at this view we're looking from the side, and this view we're looking at the front. And you can see there's a little chunk out of the talus bone here. And you can see the little chunk there also. And this patient was having a lot of pain with activities, and it was affecting his everyday activity and his lifestyle. So what we did is cut the bone here in the tibia and flapped it down. And then what we did is went in, and where that chunk was, we cleaned it up and got good bleeding bone there, and actually put some cartilage and fixed it with glue so that there was no defect there and there was a nice smooth ankle joint cartilage. And then we had to replace the bone that we had flapped down, and we did that with the 3 screws. This is another patient that had multiple trauma to the ankle. Again, we're looking at MRI here, and you can see there's a large defect there and some inflammation also in the joint. This is looking from the front of the ankle joint, and then this is looking from the side, and you can see a pretty large defect there. So again, went in, had surgery performed, discussed all the conservative options also, and flapped down that medial malleolus or that tibia and actually took the cadaver and measured the size of the defect. Actually went in and curetted and sawed out the defect, measured how big the defect was, and then went to that cadaver bone talus and cut out a piece the same size and put some glue in there and then fixated it with little darts or little anchors. And now he doesn't have any defect anymore. Distraction arthroplasty. This is when the ankle, again, is debrided, either arthroscopically or through the scope, or open, and all the loose cartilage is removed and it's cleaned out and irrigated, and the bone spurs are removed. And then what you do is you put wires through the tibia and also through the calcaneus and the talus, and then you stretch that ankle out. And that is supposed to help hold the ankle stiff and promote healing of that joint. Ankle arthrodesis. In this, we've decided that there's too much trauma, too much damage, too much bone formation to go in and clean it out or to replace a defect. So what you do is actually remove all the cartilage from each side of the joint. And after you do that, you reapproximate the bone that's left or put the joint back together, and that way you can fix it if it's a little crooked one way or the other, and then you fixate it using plates or screws or even a large nail all the way up through the leg. And this way, again, we talked about that an ankle doesn't have pain if it's functioning normally. There will be no motion there. So again, that should eliminate the patient's pain. This is a patient that slipped and fell. She was putting on a bathing suit and slipped and fell. And as you can see here, oops, sorry again, she has a pretty significant fracture of her tibia. And you can see that this is looking from the front and this is looking from the side. This is another recreation. Yeah, she did a pretty good job on that. And this is looking at the MRI also. So at first, did surgery, put a frame on there, or those like wires that we were talking about, and stretched it out, got it back to length. Then she went on to have it repaired. She fell after we repaired it. And so the decision was made to go in and actually fuse it, use a bone graft and actually fuse the joint so that she would have a stable leg to walk on. So we used a bone graft and actually lined everything back up where it was supposed to be, and then drove a large nail all the way up from her heel bone, you can see, all the way up her leg, and then stabilized it with plates and screws, so that she would have a stable foot and ankle to walk on, and again, hopefully have no pain because there would be no motion in that area. Surgical options. If you still want motion, then we go with the debridement or the allograft or the cadaver bone arthroplasty, that distraction arthroplasty, or the total ankle replacement. No motion, it would be that arthrodesis or the fusion. So obviously I brought a total ankle replacement set, so you know we're going to talk about that too. When we talk about total ankle replacement, what you're doing is resecting the cartilage. You're actually opening up the joint again, getting all those bone spurs out of there, and resecting the cartilage on each side, taking it out, and actually replacing your joint and your cartilage with a new joint, kind of like a total hip or a total knee. So you make a cut in the front of the ankle, you move everything gently aside, the nerves and blood vessels and tendons, and then remove all those bone spurs and the damaged bone and the cartilage, and then we put the artificial joint in. We ream up into the tibia and then ream into the talus, remove all the bone, and then use a special glue to hold each component in place. Put everything back together and close up the wound. Usually, again, like with hip or knee, this is something that you want people moving quite quickly with because you don't want this brand new fancy shiny joint stiffening up. So once the incision is healed, we're trying to get you doing range of motion so that you can get back walking again. There's always risks with every surgery, obviously bleeding, nerve damage. You could have an allergic reaction to the components, infection, loosening of the device, pain from the device. You might hear some creaking, although I've never had a patient say that they hear their device creaking. bone breakage, what would happen usually in the OR if that was going to happen, and blood clots. So this is a picture of a total ankle replacement. You can see the patient actually had a fracture many years ago, and you can see the little holes, hopefully, from back there. We took out a plate and screws that she had fixated for the fibular fracture, and she actually had a plate and screws here also. So went in then and cleaned up all the spurs on the sides of the joint and actually cut the cartilage away on the top of the joint here in the tibia, and then cut the bone in the talus, and then put in the replacement. We actually ream up through the heel bone into the talus and then make a nice core for these components, and then put the components in one at a time, and then add the plate, and then we've shaved the bone here at the talus also, and then we can drill and put, you can see there's a couple little holes, put that talar component in too. There's also, what you can't see, a little polyurethane or a little plastic liner that you put in there to help with the motion. Some of the things that you should know about if you're doing this also, doing these now in people as young as 30 and as old as their 80s and 90s. Obviously, if you're having it done when you're 30, you're probably a little more active than someone that's 90. So what sometimes needs to happen is this liner, this polyurethane liner, may need to be replaced, because if you are more active and this is going to be in for a longer period of time, that liner can wear down, and then we go in, remove the liner, clean everything again, and then put a new liner in. So, any questions at all for myself or for Dr. Sheridan? Thank you. Her question was, if you do the no motion, does it totally restrict your movement? No. Actually, you'll compensate for that ankle being fused by the knee and also your subtalar joint and your mid-tarsal joint. So the joints, I don't know if I can find it. I don't know if I have a good picture. The joints right here and over in here will kind of give you some of that dorsiflexion, or pulling your foot up and down and also turning in and out. So people do function very well with the ankle fusions. Yes. There are certain things that they can't do. I don't know how about they do well with ladders. Sometimes some people have problems with uneven surfaces, but it kind of depends on the patient.
No, there's not a covered service under any insurance policy or Medicare or anything. It's an out-of-pocket expense, just like LASIK would be for an eye situation. No, it's an infection, but it's one of the infections they don't like to cover.
What is the cost?
The cost, we usually charge $200 per toe, or if it's the entire foot, we charge $650 per foot. And again, that includes all 3 treatments, 6 weeks apart. And like I said, if it's 1 or 2 toes, we'll do individual toes. But once you get more, if you get 3 toes, then we basically have to do the whole foot. But that's the cost. But no, it's not a covered service under insurance policies, and it never will be. They just don't want to cover that. Yeah, it's not always that you can have psoriasis and other skin conditions that can also mimic that area, but most of the time it is fungus involvement. And it mainly happens in the older population. Younger population, you're going to see it in athletes. A lot of runners, basketball players, tennis players will get fungus at a younger age because the trauma to the nail will allow the fungus to get under there a lot easier. Otherwise, you're looking more, and you started seeing it in your 50s and 60s. By the time they get in their 70s or 80s, a significant number of people have some involvement to some degree. If you go to a nursing home, you're going to see it extremely frequently. You go to a high school class, you're not going to see fungus nails very often at all.
Usually when we're using those allografts, or when we're going in and debriding it, it's been some type of traumatic episode, and they have like an ankle sprain or some type of injury where they've just twisted the ankle and took a little defect or chunk out of that area. So the rest of the ankle, there might be some synovitis or that inflammatory tissue in the joint, but other than that, everything else, the cartilage is in great shape. Versus the wear and tear, we're usually looking at doing the debridement or the fusion or the ankle replacement. Thank you.
We have a question here in Waupun.
Sure.
Relating to the wart removal, we heard Dr. Sheridan talk about insurance coverage on laser overall, but the question was specifically on wart removal. Is that included in insurance?
Yes, wart removal will be covered by insurance, as well as scar tissue revisions and things of that nature would be covered. This will not cover the fungus nails.
The debridement or the debridement, is that the actual shaving down of the nail itself to make it less thick. It's okay. I didn't know if it was. Seen it, but sometimes I was thinking, well, is it under the nail? You know, that you're debriding, but it's actually shaving the. Okay. All right. Thank you.
This makes it easier so we get proper penetration to get to the fungus particles that are underneath it.
Are there any other questions for our doctors? Excellent. Thank you so much.
I have a question.
Oh, sorry about that.
As far as the total ankle replacement, do you ever do a preoperative bone density exam to see if the patient if the total ankle replacement will be more valid, if it'll stay put better, or?
Right, that is one of the concerns, and that's like we were talking about with the breakage. So if we are concerned about osteoporotic bone, we can do, we'll look at the x-rays, and a lot of times you can see them on x-ray if they are osteopenic or have osteoporosis. Otherwise, we can get a bone density scan, yes, also. And usually, a lot of times before we'll do this too, we will do a diagnostic block to see, use some Novocaine or lidocaine, and just see if that helps, and then we'll know if it would be a good procedure for them also.
Thank you.
Any other questions? For real? All right. Thank you so much, doctors.